Welcome to the narrated PowerPoints portion of the Fast Track Implementation for Consistent Assignment Kit. This audio portion of the presentation is designed to accompany the written Consistent Assignment Implementation Kit. This part of the kit is targeted to administrators and directors of nursing, because if you are putting in consistent assignment in a way that will stick, there will be decisions to be made that only someone in authority can make. Decisions concerning the makeup of your staff or dividing up your building, for instance. We will broach these topics as they come up. Consider the kit in its entirety as a basic how-to for implementing consistent assignment. This narrated PowerPoint is a supplement to the written guide that will give you extra information to ease you into the process and ensure your success. As the person who is leading this change, you'll need to view these webinars prior to each of the 3 meetings outlined in the guide. After you have viewed each webinar, you will need to decide if you would like to share some portions of it with your team members, either prior to or during the meeting. The narrated PowerPoints and the guide take you through 3 meetings for Fast Track implementation. We know this is ambitious. Your first decision will be to decide how many meetings it will take your home. Every home is different, and you may need more time between meetings or more meetings, depending on how much consistency you already have in place. You will need to be very realistic as you set this in motion. This is an overview of the 10 steps, color-coded by the 3 meetings. Steps 1 through 4 are covered in this webinar and your first meeting. Steps 5 through 9 cover meeting 2, and step 10 covers meeting 3. As I said earlier, you will need to make some decisions up front about how quickly you will go through this process with your team. Now we're going to take you through the 10 steps in more detail. Step 1 takes place before your team even meets. The very first thing that you'll be doing is forming a team. Successful teams are made up of the right people for the task at hand. Everyone on this team will be a working team member. Carefully consider who, as well as what, staff positions you want to involve in this process. You definitely need to have people who can make decisions to be part of this. You don't want to have a team that works out a solution to a problem, but then has to go back to ask someone else permission before proceeding. This work requires a real grounding in the day-to-day experience of your staff, so you will want to include people who know your building in an intimate way. Be sure to include a CNA and a floor nurse. You will also want to have people who are key to implementing your process. So consider including your scheduler and staff development, and someone who is involved in the hiring process. As you are forming your team and asking people to be part of it, let them know that this is a working team and that they will have assignments before each meeting. For the CNA and charge nurse, you will need to provide coverage so they can attend meetings and then have time to complete their assignments. These are the assignments to be covered before the first meeting. All team members need to watch video 1 and read the handout on consistent assignment. As the team leader, your job will be to make sure team members are prepared for the first meeting, as well as to create the space and set the tone for the first meeting. Your space should be one where you can really get work done. It is hard to have a working meeting if there are constant interruptions or overhead paging. Timing needs to be considered as well. You want to be sure your meeting time is set for a time when people can attend. Usually for CNAs and charge nurses, 10 a.m. and 2 p.m. are good times, but your building may have other times that work out better. Or you may have resources to provide coverage so they can be off the floor. But be sure to give this thought before setting your meeting time. And refreshments are always a good idea. Having a written agenda is important. When you have a written agenda, it lets people know what will be covered. And by having everything you want to cover laid out in writing, it lets people know that you consider it important. You'll also need to bring a roster of the nursing staff that includes all of your CNAs and nurses, both full and part-time staff. The first meeting will really set the tone for how you will be taking this process forward. It is designed to activate your team members. The team members, in essence, will become the ambassadors of this process, so they will need to be sold on it before they help you take it out to the entire building. This meeting will help team members understand why it is so important in a very visceral way. This process is also designed to build your team members' abilities in analytical thinking and is a high staff involvement change process, which is a requirement of QAPI. You may want to consider this a PIP. For consistent assignment to be sustained, you'll need to tap into the analytical thinking of all your staff. This implementation process is built for high involvement. When you implement consistent assignment in a way that involves your staff in figuring out assignments, you are creating the environment for their continued contributions. This is a sample agenda for your first meeting. Feel free to use it or to adapt it to your needs. Explain why consistent assignment is essential for your organization's outcomes. Use the paired drinking exercise to personalize why consistent assignment matters to residents. Discuss whether to pilot or go whole house. Assignments will need to be completed before the next meeting. You need to find out which unit or neighborhood each of your CNAs and nurses prefer working in, and gather sample data on how many staff care for each resident. Then set the next meeting date. You can play this section of the narrated PowerPoint for your team, have them view it ahead of time, or share this information with them on your own. Most questions they might have are covered in the handout in Appendix 1, which they should all have read. Go through the information on the following slides and then have an open discussion. In this meeting and throughout your implementation, you are shifting thinking from the staff experience to the residents' experience because your organization's outcomes depend on residents' experience. With consistent assignment, staff know residents so well that they recognize when a resident is not themselves. Many early warning signs are subtle. A resident has less energy, less appetite, maybe isn't able to shave himself when usually he can. This can be an indication of something brewing, pneumonia or infection, congestive heart failure. When your staff know residents this well, you can catch these concerns at the first sign and act on them before they become a full-blown episode. Knowing residents well also lets staff accommodate their individual routines and preferences. Staff come to know the small details of life that make a resident comfortable and at home. Consistency also engineers teamwork. When staff work together every day, they know each other's routines. They know when one CNA needs help with a resident and can pitch in. They can back each other up and problem solve together. Consistent assignment contributes to staff stability because staff know their residents are counting on them, and you are counting on their relationship with their residents. One key to high performance is having engaged staff who take the initiative and go the extra mile. Employees do that when they believe in what they're doing, their employers, and their role in their organizations. Most people come to caregiving work wanting to be engaged. They come with a calling to care for others. Consistent assignment engages staff with the people they are caring for and with their teams. With consistent assignment, as staff care for the same people every day, staff come to care about the people they are caring for. And staff come to feel they are in it together with their coworkers and their teams. If you then tap into what staff know, staff will feel even more engaged because they see how their knowledge of residents contributes to your plan of care for them. When you listen to what staff tell you their residents need, staff know they are making a difference. Your systems for tapping into what staff know support their engagement. When people feel appreciated and recognized for their contribution, they are more likely to go above and beyond the minimum required, and they are more likely to stay. California, like many other states, is developing payment incentives to drive performance. This study on staff stability is being used to design incentives for homes that have staff stability. Consistent assignment has a strong positive impact on staff stability, and putting it in place positions your organization to capture these financial incentives. This report finds that there is a positive correlation between nursing home staff retention and quality. It finds that the longer staff are employed in the same nursing home, the more knowledge they have to be able to provide better care. The report finds that residents are more comfortable with staff they know, and that staff are better able to respond to residents' needs when they are familiar with their residents. Knowing residents equals staff and resident satisfaction equals improved quality. At the federal level, CMS is focusing on preventing avoidable adverse events. A 2014 review of Medicare beneficiaries receiving skilled nursing care found that 22% of them experienced adverse events during their stay that they never recovered from, and another 11% experienced temporary harm. That's 1 in 3 Medicare beneficiaries in nursing homes experiencing adverse events. The researchers found that more than half of these adverse events were preventable because they were not a natural progression of the resident's condition. They were instead the result of substandard care, inadequate monitoring, or a failure or delay in necessary care. With consistent assignment, CNAs recognize early signs that something is wrong and can act quickly to address it before it becomes a serious and irreversible decline, as long as the rest of the team listens to what CNAs say. These are the clinical conditions that CMS considers to be potentially avoidable: congestive heart failure, COPD and asthma, dehydration, pneumonia, and UTIs. These are not sudden onset conditions. They are conditions that develop over 24 to 48 hours. A resident who collapses on Friday with congestive heart failure usually showed signs on Wednesday and Thursday. Consistently assigned staff will recognize these signs and let the team know so that they can be treated before they become acute. Consistent assignment in today's nursing homes is no longer just an option. It is imperative. Your nursing home survival depends on your ability to perform at a new level of quality that you can only achieve with consistent assignment. Consistent assignment is necessary to meet revenue and quality demands from corporate owners and managed care companies. Comply with CMS and state regulations. Keep star ratings above 3 to participate in hip and knee bundling with partner hospitals. Raise substandard quality measures. With consistent assignment, you can implement effective quality improvement programs to raise your quality measures. The new QAPI regulations call for high involvement of staff closest to the resident. Consistent assignment will help you implement individualized care and follow residents' customary routine. The regulations stress attentiveness to quality of life and person-centered care. When staff know residents well, and the rest of the organization adapts to what CNAs say their residents need, then your organization can implement individualized care. Consistent assignment will help you follow clinical best practices and help prevent avoidable declines. Consistent assignment positions your organization to succeed in performance-based purchasing. We've shared with you the business and clinical reasons for implementing consistent assignment. Let's bring the discussion to a more personal level by doing a short exercise that gives everyone a direct experience to understand why consistent assignment matters so much to people who are receiving care. The exercise takes about 10 to 15 minutes, including discussion time. To do the exercise, you will need straws, pitchers of water, and cups for each participant. Have everything ready before the exercise. In a go-round, ask people to count off 1, 2, 1, 2, so that everyone is either a 1 or a 2. The 1s are now nursing home residents who have no use of their arms or hands, and the 2s are now CNAs. Every nursing home resident needs a CNA. CNAs decide which resident they will take care of. If there is an odd number, one CNA will have 2 residents. Now pause the webinar and do the paired assignment. Have an open discussion about the experience. Ask, what did it feel like to be helped to drink? Keep asking participants until you've heard from most of them about their experience. Now ask staff, what would it be like if you had dementia? Ask, what is the difference for a resident in having the same caregivers day in and day out versus having new caregivers? Consider asking them to pair up and discuss what hits home for them about how consistent assignment can help improve residents' experience. Take your time with this discussion. The exercise gives staff a personal understanding of what it feels like to receive care. As staff reflect on their own experience, they better understand what residents feel. They see how residents feel more comfortable with care when they have caregivers who know them well. End the discussion by letting people on the committee know that they will be taking this exercise out to the rest of the staff. Talk about how to do that and who wants to be involved. Then take the team into discussion about steps they will need to take to help implement consistent assignment. Piloting is a way to put something in place as a staged process where everyone learns from those who go first. This is often a way to move forward in a large building where it can be hard to stay on top of things otherwise. Usually, piloting is the better way to start because it allows you to learn from small mistakes and continuously improve your process on a small scale before you roll out something to the entire organization. However, some buildings, especially smaller buildings, may find running 2 systems at once, which is what you do when you pilot, difficult, and opt for a whole house change all at once. Implementing consistent assignment requires so many changes that some homes opt to take it on throughout the whole building because then it is done, and with less time spent on disruption. Changes to the staff composition, assignments, and scheduling may be easier to do for the whole building than piecemeal. At your first meeting, begin preliminary conversations about this. Evaluate your readiness to manage a whole house conversion to consistent assignment, including the support you will need to provide to each area work team. This may be something that is almost already decided at this point, or be a factor that is totally up in the air. If this is an issue that needs to be decided, plan on making a final decision at your second meeting after you have collected more information. If you do choose to pilot, you'll want to choose the area with the best chance of success, an area with a charge nurse who is a solid leader and CNAs who are willing to take on change. The first assignment that team members are going to be asked to volunteer for is to bring to the whole home the paired drinking exercise that the team has just done. Consistent assignment involves your whole building, so it's important for everyone to understand why it is important, so they will embrace it. When people understand what it means for residents, they usually become supportive. So for this assignment, the people who take this on will follow the same process you just used in your team meeting. Narrated PowerPoint number 4 is a step-by-step guide for these meetings. Have anyone who takes this assignment view it and decide if they want to use it or parts of it. Make sure that those doing this in service are prepared for a full discussion with staff about the benefits of consistent assignment. They should be instructed not to engage in a discussion about not doing it. This is about why you are doing it, not about if you are doing it. They should also share that there will be a process for including everyone affected in the process of making sure that the assignments are fair, and they will hear more about this as the timing gets closer. In this process, your team members will meet with staff in small groups, conduct the paired drinking exercise, Discuss why and how you will be implementing consistent assignment. Review the handout in Appendix 1, Consistent Assignment, Why is it so important? And answer questions about why and how. Everyone will have an assignment. In addition to the paired drinking exercise, the next assignment is to find out where people prefer to work. You will want some team members to take this assignment. Make sure that whoever takes this on has the ability, in terms of time and familiarity, to do it well. For this assignment, have a roster of your nursing staff designated by full-time, part-time, and per diem. Divide names among team members who are doing this assignment. Have them ask each CNA and nurse if they are working with the population of their choice, and if not, then what is their preference? Have staff rank first and second choices of assignment. For this assignment, you'll measure your current consistency. Collect data to find out how consistent you currently are. Determine the current state of daily assignments, not on paper, but in reality. To understand how much consistency is currently in place, you will need to collect data. Gathering this information establishes your baseline and lets you set realistic goals. You can gather this information for a sample of residents or for all residents. If you have decided to pilot and are sure about where you want to start, you can gather your data in that neighborhood. Data collection includes both a resident-focused measure and a staff-focused measure. For the resident-focused measure, choose a sample of residents to gather data on. Look at documentation and count the number of CNAs that have signed off on each resident's care. Compare that with how many CNAs would be involved in a resident's care if you were at 100% consistency. Consider all 3 shifts and weekends. A 100% consistency number will probably be somewhere between 9 and 12 CNAs providing care for each resident, depending on your way of scheduling. Advancing Excellence has a consistent assignment tracking tool. See the appendix for more information. For the CNA-focused measure, count the number of times CNAs and nurses are moved from their scheduled assignment to cover other assignments due to another employee's unscheduled absence. If you think you have consistent assignment, you may be dismayed if the number is large. But having an accurate picture will give you a baseline that will help you set realistic goals for improvement. Given the importance of consistent assignment, your goal should be not to move staff from their assignment. Set that as your target. There are a lot of tasks to take from this meeting. How your team takes on these tasks will affect your outcome. By having everyone take parts of the work, you are creating a team that has the potential to be highly engaged and involved in the process. If just a few people do all the work, then they become overburdened and may end up resenting being part of it. To make this something that your team enjoys, be sure to give thought ahead of time to assignments. When possible, team up people for an assignment. Create the conditions for success by making sure that no one is overwhelmed. Decide realistically how much time you need between now and the next meeting to accomplish this. See the grid in the guide, make your assignments, and set a date for the next meeting for sharing the results of their assignments and taking the work forward. This is the end of Webinar 1.